Tomorrow is a really important day. Tomorrow there will be a protest in Dublin, meeting at the Garden of Remembrance at 2 p.m. And this protest is in memory of Harvey Morrison Sharretts. Harvey tragically passed away a number of weeks ago. He had suffered scoliosis all his life. And in his short life, he suffered extreme pain and suffering and was in and out of hospital as a result of many conditions related to scoliosis. It's absolutely unforgivable that Harvey didn't get the treatment that he needed in a timely fashion. And it's incredible that in 2017, the then Minister for Health, Simon Harris, promised that no child would go longer than 4 months without an operation. And yet Harvey waited for 33 months for an operation. He was promised an operation in 2022. In 2023, that operation was cancelled without the family being told why or even being informed. His family have battled courageously and bravely during Harvey's life, and now they're asking people to come out in their thousands tomorrow to make sure that this happens to no other child in the future. Indeed, one of the objectives of tomorrow's march is for Simon Harris to resign. He is not fit for office. There's absolutely no way that a minister who literally underwrote a promise that no child would have to wait for longer than 4 months would then preside over a situation where hundreds of children are currently on a waiting list, many for 4 and 5 years. Indeed, those waiting lists are getting longer at the moment. Are we simply going to allow this minister get away with it? Is Ireland going to remain an accountability-free zone? Or are we going to stand up for children who are currently on that waiting list? And that's why we're asking people to come out in their numbers at tomorrow's march. We in Aontú have promised to put forward a motion of no confidence in late October, early November, in the Taoiseach Simon Harris, if no other political party do so. We will use our private members' bill to put as much pressure on this government to make sure that there is accountability. We've also found out that CHI have 36 million euros currently in the bank, money that was donated by the general public. And indeed, this proves that these lack of operations are not because of clinical decisions, but because of capacity decisions. In one hand, CHI have 36 million euros, and on the other hand, they don't have the capacity to deliver the health treatment that they need. This is unforgivable. And also, we found out that many children are coming off those waiting lists, not because they've had the operations, but because they're simply getting too old. They're reaching the age of 18, and they're no longer children. Now is a crossroads for accountability in this country. It's a crossroads for children's health. And it's a crossroads, I believe, for the whole health service in Ireland. Let the government know loud and clear that you will not accept this lack of accountability ever again. Be there tomorrow.